I want to explain to you what sciatica is because it's misunderstood. I'm going to explain to you the two major causes of sciatica that you could be experiencing, and then I'm also going to explain to you some treatment options that you can use on yourself. Now, I'm James, I'm an osteopath. I treat sciatica all day, every day. Sciatica is impingement or irritation on the sciatic nerves, so the nerves that come out of the lowest part of your spine, and irritation on those nerves will send pain or burning or shooting sharp pain straight down the back of the leg all the way to the foot, but also potentially on the front of your shin. If you get pain at the front of your thigh, that's not sciatica, that's coming from the femoral nerves, which is slightly higher up. And if you're just getting back pain, that's not sciatica because that's just back pain. That's not impingement on a sciatic nerve creating a sciatic pain down the leg. So that's sciatica. Now, the two major reasons you might be getting sciatica are number one, irritation or pinching on the nerve at the spine, potentially from a disc bulge, so a lower back disc bulge which is pressing on the nerve, or maybe some wear and tear which is reducing the space for the nerves to pass out of the spine. The second way potentially is Piriformis Syndrome, a muscle that goes from the back here all the way through to the tip of the hip here, and this muscle is very close to the sciatic nerve and can get tight and pinch on that sciatic nerve. If you've got pain starting in the buttocks, going down the leg, which is maybe really sore when you're sat for a long period of time, that could be Piriformis Syndrome. If you get back pain with sciatica and the pain originates in the lower back, that's probably coming from the lower back. Not definitely with these things, but potentially probably. Now, with regards to Piriformis Syndrome, there's an exercise you can do called the figure of four stretch. You can do it lying on your back, you can do it on a bench. I'm going to show you a video now very quickly where I'm explaining the exercise and I'm showing you the exercise on a bench. Now, the other way we could of course get sciatica is that pinching of the nerve at the spine. What's really useful here, especially if it's coming from a disc bulge or prolapse, is to distract your spine, decompress your spine. Again, I've got another video where I'm explaining how we can do this off the end of a bench in my treatment room in another clinic. So you're going to watch that video now. Off the edge of a chair, and you hold on, you lift your hips off, and you just let your legs drop. You let your hips drop and the weight of your back drop. You can even move yourself around if you want. And what that's doing is it's distracting your spine. So you can see that we've got the decompression of the spine to take pressure off the nerve when it's impinging at the spinal level. We've got a stretch to stretch out the the piriformis muscle, which will then take pressure off the sciatic nerve. Give these two different methods a go. Maybe do them both, maybe do the individual one that you feel correlates with your specific type of sciatica. And of course, if it doesn't help, you need to seek out the help of an osteopath, a chiropractor, someone that can properly assess you, get to the underlying cause of the problem, and then educate you and treat you to get rid of the sciatica.